Audio Jungle.
A very warm welcome to another Dr. T Health Mastery series where we aim to educate, enthuse and help you along your journey towards becoming a master of your own health. Remember, nothing said here is to be taken as advice for your specific medical condition. If you've got any symptoms, any concerns raised by anything that I'm going to discuss today, please speak to your personal GP or physician to get a more tailored advice. What I want to talk to you about today is a very important eye condition called glaucoma. Now, glaucoma is the leading cause of irreversible blindness globally. 66 million people are affected around the world and 12 million are registered blind around the world as a result of glaucoma. And this is probably an underestimate. Glaucoma is responsible for 10% of those registered blind in the United Kingdom. This particular video is going to focus on the most common type of glaucoma, and that is primary open angle glaucoma. Now, glaucoma is very closely associated with ocular hypertension. This is raised pressure within the eye. People can have a raised pressure within the eye without actually having glaucoma. However, most people who develop glaucoma have raised pressures within the eye. Therefore, if someone is found to have ocular hypertension, it is really important that they're closely monitored to pick up any developmental glaucoma at an early stage so that interventions can be put in place promptly. Glaucoma is a group of diseases where, as I mentioned, there's usually raised pressure within the eyes that causes a progressive damage of the nerve of vision, the optic nerve. And this damage causes irreversible visual loss. So any vision that is lost as a result of glaucoma can never be recovered. Therefore, the aim in treating glaucoma is to control the pressure within the eye, reduce that progressive nerve damage, and prevent future vision loss. So what is the normal pressure within the eyes? Well, you may be interested to know when you visit the optician to know what this is. So the normal pressure within the eye is between 11 and 21 millimeters of mercury. So anything above 21 millimeters per mercury is referred to as raised intraocular pressure. However, not everyone with glaucoma has a raised intraocular pressure, and that is just purely because some patients, their optic nerve is a lot more susceptible to damage, and so the damage occurs at much lower pressures. So whether you have acute angle closure glaucoma or primary open angle glaucoma, it's all to do with the angle between the iris and the sclera. And this is the area where aqueous humor, that is the fluid that is produced at the front of the eye, is drained. If that fluid drainage is inadequate, the pressure within the eye can rise, and that can lead to damage of the nerve of vision, the optic nerve. I'm going to spend a few minutes just orientating you to the relevant anatomy of the eye in relation to glaucoma. So I'd like to talk you through the relevant anatomy of the eye in relation to glaucoma. So at the very front of the eye here, you have the cornea, and then at the very back, you can't see this on this diagram, you'd have your retina, and that's also where your nerve of vision, your optic nerve, would be. But for the purpose of glaucoma, this is the relevant area. So this oval structure here is called your lens, and in front of the oval structure, you have two protrusions called your iris, one on either end. The space between the iris is your pupil. At the back of the iris, you have the ciliary body, and that's where the aqueous humor is produced. That fluid leaves the ciliary body, and then it makes its way through the gap between the iris and the lens, and that's called your posterior chamber. It then goes through the pupil and into this larger space called your anterior chamber at the front. Aqueous humor leaves the anterior chamber through the trabecular meshwork in both corners of the anterior chamber. If this angle is very narrow, it's known as narrow angle glaucoma. If the angle is normal, then it's just called open angle or normal angle glaucoma. And so this is really where the difference comes in terms of whether someone has narrow angle or open angle glaucoma. The more narrow this angle is, the more difficult it is for the fluid to leave, and the more likely it is for fluid to accumulate in the anterior chamber, causing a buildup in pressure, which can then cause pressure on the optic nerve, causing damage, or pressure on the blood supply to the optic nerve, equally causing damage. At the corner here, you have, from where the cornea ends, you have the sclera, and the sclera makes its way all the way around the eye on both ends. with any medical condition, it is really important to know what the risk factors are, because knowing what they are can help you take measures to reduce your chances of developing them in the future, or to better manage it going forward and reduce complications. Ocular hypertension, that is raised pressure within the eye, is one of the key modifiable risk factors. This affects about 3 to 5% of the UK population. Not everyone with ocular hypertension develops glaucoma, but it is a key risk factor for the development of glaucoma. Primary open-angle glaucoma affects 2% of the population within the United Kingdom, about 3% of the population globally. But what we find is that the actual prevalence, so the percentage of people affected, increases with age. So in the United Kingdom, for example, about 1% of people at the age of 40 are affected, 3% of those at the age of 60 are affected, and 8% of those at the age of 80 and above are affected. Globally, people from sub-Saharan Africa have the greatest prevalence. So compared to a global prevalence of 3%, in Africa about 4.2% of the population are affected, and that is probably an underestimate. Some of the key risk factors, therefore, are age over 40 years old, being of African ethnic origin, having a family member who's had glaucoma in the past, or a first degree relative, such as a brother, sister, mother, father. Having type 2 diabetes is also a risk factor. Other risk factors also include having short-sightedness. Ethnicity is one of the key risk factors. So about 2 to 3 times more black people are affected compared to Caucasians. There are some important secondary causes of glaucoma that are not the focus of today, but some of them are worth mentioning, and that is the use of steroid, especially steroid drops, but it can also happen with steroid tablets or steroid injections. Also, trauma to the eye can lead to the development of glaucoma. So there are risk factors, but the actual cause of glaucoma isn't actually clear. It is thought that it's highly linked to a reduction in the clearance of aqueous humor through the trabecular meshwork, and that due to the process of aging, you have damages within the trabecular meshwork that reduces the efficiency with which aqueous humor is drained from the eye. Now, how do you know whether you've got glaucoma? This is a very important question. Actually, in the vast majority of cases, people don't know that they've got glaucoma until it is very advanced, and that is because glaucoma almost sort of creeps up on you. It causes no symptoms in the early stages. It causes progressive damage of the nerve of vision that first tends to affect your peripheral vision. So this is your sort of outside vision, and only in most cases when people have lost something like 80 to 90% of their peripheral vision do they then develop symptoms of blurred vision, or difficulty with seeing, especially in the dark or in the evenings, and that causes them to visit an optician, and the diagnosis is made. But when the diagnosis is made as a result of you presenting with these symptoms, it is usually quite advanced, and as I mentioned earlier, any vision that's lost as a result of glaucoma, unfortunately, cannot be recovered. And as a result of this lack of symptom, this asymptomatic nature of primary angle closure glaucoma, it is estimated that about 50% of patients with glaucoma are undiagnosed because they're unaware of it and as a result have not sought help. Therefore, it is really, really important to take preemptive action. So what do I mean by this? Now, it is recommended that everyone over the age of 60 years old should have their eye tested by an optician, optometrist, at least once every 2 years, and at least once every year for everyone who is over the age of 70. Now, if you have a family history of glaucoma, you should have your eye checked at least once every 2 years from the age of 40 and above. If you are of African ethnicity and you have a family history of glaucoma, you should also have your eye checked once every year from the age of 40 and above, and once every 2 years if you have African ethnicity without a family history. So the bottom line is you've got to have an awareness that there is a condition that exists that is called glaucoma, which once damage has been done to the vision, that visual loss is irrecoverable, and therefore you should be proactive and take preemptive action to have your eye checked periodically, and from the age of 40 and above, depending on your family history or your ethnicity, you should be having your eyes checked at least once every 2 years, and everyone above the age of 60 should be having their eyes checked once every 2 years and once every year above the age of 70. Now, having said that, there are times when someone may actually develop acute complication of glaucoma, and this is where the pressure within the eye rises significantly suddenly, and this can cause a painful red eye, very watery, and the patient often is really intolerable of light and wants to be in a dark room, and often also has a headache. They may feel nauseous and even vomit. And when they look at their eyes is really red and quite injected. Their pupil, instead of being nice and round, is sort of dilated and irregularly shaped. So if you develop an acute, severe, painful red eye with headache, nausea, vomiting, etc., and you don't have to have all of these symptoms, the key is you've got to seek healthcare advice as soon as possible, because prompt action needs to be taken in order to prevent irreparable loss of your vision. Now, I know you might be wondering, well, if most patients don't develop symptoms at all, then how is glaucoma diagnosed?